My name is Donia, and my topic for the Ergogenic Aid project was branched-chain amino acids, or BCAAs. As an introduction, BCAAs are essential amino acids with branched structures, which is where they get their names, and they have become a popular ergogenic aid. The three BCAAs are leucine, valine, and isoleucine, and I think this image at the bottom does a really good job of showing their branches if you look in the red. So now let's answer, can a few amino acids really change how we perform and recover after exercise? For the history of BCAAs, they were first identified as essential amino acids in the early 1900s, and in the 1980s, some research was provided to show they delay fatigue, and so a rise in the use of BCAAs as supplements in athletes increased. Then in 1988, research showed that they could also have some therapeutic effects for certain medical conditions and disorders, and since then, BCAAs have been used a ton in sports by athletes and for recovery after brain injuries, especially in military settings. So, common uses of BCAA supplements include, again, the medical use, which they can be prescribed to treat brain disorders, for preventing liver cancer in patients with cirrhosis, and improving mental function. And more specifically and importantly to us, they can be taken by athletes to hypothetically help with muscle building as well as preventing muscle soreness, preventing fatigue, and improving performance. They are usually taken orally in powder or capsule form, or they can be used as part of a sports drink, which we can see in these images down at the bottom, all the different types. So now, do they really work? So in terms of muscle soreness, they have been shown to reduce the delayed onset muscle soreness, or DOMS, by approximately 30% after exercise. And studies also indicate, in terms of muscle damage, they can decrease levels of muscle damage markers, which suggests they do have a role in lowering protein degradation. As far as performance enhancement, most studies have not found significant improvements in athletic performance metrics such as VO2 max or endurance levels, but for muscle synthesis, they can activate molecular pathways that initiate and stimulate muscle protein synthesis rates, and they can also increase anabolic hormone secretion to aid in muscle building. However, many of these studies say that the results aren't extremely significant, and many of the times, if you're getting adequate and complete protein through the diet, there may not be a need for additional supplementation. So for the safety, they're generally safe to consume up to 20 grams a day, with the maximum safe intake of leucine specifically being 550 milligrams per kilogram body weight. Rare side effects include GI pain, nausea, and headaches, and you should avoid taking them if you are breastfeeding or pregnant. Also, they may have interactions with some medications, so if you're taking any prescriptions, you should talk to your doctor before considering using these. The cost for BCAA supplements are usually $20 to $50 for 30 servings, and some popular brands include Bucked Up, Extend, or Alani. Some practical advice is that you may be able to use BCAAs to help if you are fasted or in a calorie deficit and not getting enough protein, but they are likely unnecessary if you're consuming high quality protein in enough amounts. You should really focus on full nutrition first and supplement second. If you do choose to try them, you should focus on getting 6 to 12 grams per day as the recommended dosage for any benefits, and you should try to find brands that offer a 2 to 3 to 1 to 1 ratio of leucine to valine to isoleucine. Here is a list of my references, and thank you.